Today we're going to cover the brief interview for mental status, otherwise known as the BIMS. My name is Amy Craven from C&V Senior Care. The basic interview instructions for the BIM are to interview the individual as long as they can speak clearly and they understand you. You can use an interpreter if necessary. Conduct the interview in a private setting, if at all possible. Be sure the individual can hear you. Give an introduction. Sit so the individual can see your face if they do have a hearing issue. And then you want to make sure that you give them an introduction. I'd like to ask you some questions. We ask everyone these same questions. This will help us to provide you with better recommendations. Some of the questions may seem easy, while others may be more difficult. If the individual then expresses concern that you are testing his or her memory, you want to let them know that you ask these questions to everyone so we can make sure that we meet your individual needs. Initially, you're going to tell the individual 3 words, and then you're going to have them repeat those words back to you. You need to give them a little time to repeat those words, and then you're going to go into the temporal orientation, where you ask them about the year, month, and the day. Ask the individual each of the 3 questions separately. Allow up to 30 seconds for an answer, and do not provide clues. If the individual specifically asks for clues, respond saying, "I need to know if you can answer this question without any help from me." In some cases, you may need to write the individual's response in the margin and then go back and count how many years, months, or days were missed. Do your best to keep focused on the interaction with the individual, not adding or subtracting. After you've done the temporal orientation and the initial recall, you're going to repeat that recall and ask the individual, let's go back to the earlier questions. What were those 3 words? Can you repeat those? Allow them 5 seconds for spontaneous recall of each word. For any word that is not correctly recalled after 5 seconds, provide a category clue. For example, something to wear, a color, or a piece of furniture. Give a cue for each word separately. The cues should only be used for individuals after they're unable to recall 1 or more of the 3 words. And then allow 5 seconds after category cueing for each missed word to be recalled.
Hello, Mr. Jones. My name is Catherine Vanderhorst, and I'm going to be doing your assessment today. To start with, I'm just going to ask you some questions, and then I'm also going to ask you to repeat some things back to me. So the first thing I'm going to do is I'm going to say 3 words for you to remember. And then after I've said those words, could you repeat them back to me? The words are sock, blue, and bed. Now can you please tell me those 3 words?
Sock, blue, and bed.
Okay. Now I'm going to ask you about the time. Could you please tell me what year we're in right now?
2017.
Okay, great. And what month are we in right now?
August.
And what day of the week is it?
Wednesday.
Okay. So let's go back to that earlier question that I asked you. What were the 3 words that I asked you to repeat?
Sock, red, and bed.
Okay, so the color was a color, but it was not red.
Oh.
So we're going to score Mr. Jones. What would Mr. Jones score like on the BIMS that we just completed with him? So for the repetition of 3 words, Mr. Jones was able to recall all 3 words, so he would get 3 points for that repetition of words section of the BIMS. In the temporal orientation, Mr. Jones was able to recall the year correctly, which would give him 3 points from a 0 to 3. He was able to correctly report the month, and that would give him a score of 2. And on the week, day of the week, he was able to state that correctly, and that would give him a score of 1. So the last section of the test was the recall, where we asked him to recall the 3 words that we'd had him repeat initially, and he was able to recall 2 of the 3 words. He did not get the 3rd word, which was blue. He had said red. So for sock, he would get a 2. For the color, he would get a 0. And for bed, he would get a 2. So his total score would be 14 out of 15, which would be indicative of somebody who was cognitively intact. Some other comments regarding scoring. It's important to remember that when in the first section, when you're getting the person to repeat those 3 words, that you can repeat those words and give them cues up to 2 times. In the last section, when you're having them recall words, it is okay to give the person a cue, and such as something you might wear, or for the color blue, a color, and you may be able to do that, give them that cue up to 2 times, and give them a few seconds to see if they can respond. As far as the scoring of the BIMS, 13 to 15 is indicative of somebody who is cognitively intact. An 8 to a 12 means they're moderately impaired, and 0 to 7 could mean they're severely impaired. But like with everything else, any of the assessments that you do and the scores should be referred to the physician for further evaluation of the client.